as a veterinarian, it's very disappointing to me to see that I'm not making a huge difference in a lot of animals. And with 46% of dogs getting cancer and 39% of cats getting cancer, as a small animal practitioner, I feel often that there are things that we're doing that are not good enough.
Was originally a conventional veterinarian, very, very conventional, very, very limited in my paradigms.
You spent 4 years in veterinary school and then you did your internship or your residency. You're committed to a certain type of professional training that you've had, and to go on and to start putting your toe into other alternative modalities, sometimes people feel like, I know what I need to know and I know it's in this box and I feel very secure that's what I know in this box.
It's kind of an unknown, really, in the vet world.
Ozone therapy, as I have said many times in my life, is probably the best thing that I have added to my care regimens in my whole career.
Kind of become the foundational tool, really. A lot of times it's the reason they're coming to me.
Well, I believe that if you're not using ozone, you need to.
So I finally decided to do it, and he lived 2.5 years after Tufts University said, this horse is dead, there's nothing else you can do for him, you need to euthanize him immediately. And that's how I got into ozone. It's just, I felt sort of like there was no other choice. Euthanasia was my only choice, and that wasn't good enough for me. So why not try something that might help him? And he lived 2.5 more years of quality jumping in horse shows and having a great life.
Yeah, where I came across it was I was looking for options for my wife, who was having a severe respiratory situation, and the doctor started throwing out heart-lung transplant, and so we started with some ozone, and she's gone back to riding horses and done very well. And the last time she had a CAT scan, her doctor, who wanted to put her on steroids, heavy doses of steroids, and she would not do that, looked at her and says, I don't know what you're doing. And knowing your husband, I probably don't want to know what you're doing, but my suggestion is you continue doing it. And she's back to riding and doing much, much improved.
When you have inflammation, when you have swelling, when you have bruising, when you have trauma, when you have any kind of an infection or even cancer, you have higher amounts of carbon dioxide that build up in the tissue. And if there's some way to bring down that inflammation of the carbon dioxide, and you can bring down the inflammation, bring down the pain, start the healing cascade, encourage mitochondria to start functioning more efficiently inside the cell, you can actually have cells start to heal. And what is the most important nutrient that you need to give to cells is oxygen.
And there's no easier way to oxygenate the patient than ozone.
Another great case we just had was a mare that had a uterine infection for over 2 years. I happen to know it's my mare, and very aggressive therapy. Of course, her last foal was a Horse of the Year world champion now, and finally this year we started lavaging her with ozonated saline, and we've delivered 2 embryos so far this year. So the first time that's happened in 2 years with this mare, fighting chronic endometritis.
There's a lot of modalities out there, and we can't have all of them, but I feel that ozone is one of the most basic, because what do animals need? They need hydration. We all have IV fluids, sub-Q fluids. Nobody would not have that. And the same thing, oxygen.
I find that ozone is the cornerstone. It is the common denominator that improves outcomes more than anything else I do.